Welcome again to another episode of Let's Chat About Aging in Your Community. We talk about issues that cover a wide range of matters that affect older adults in their communities and looking at ways in which we can encourage people to be able to live healthy, well, and in their own homes as long as possible. Studies have shown that older adults prefer to be able to age in place in their own homes. And that's what this program is dedicated to doing, to provide the kind of information and discussion around those issues that help people to live well and with dignity in their own communities. This our podcast is brought to you by Chats. Community and home assistance to seniors. And I'm really delighted to welcome today's guest, pharmacist Rose Patodia, who's going to talk to us about medication management and use and some of the challenges around medications that older adults have, and most importantly, how you can access your community pharmacist to provide you with the support you need and information and make sure that those medications are taken appropriately and in a way that will keep you well as opposed to doing harm. So, Rose, welcome to Let's Chat About Aging. Very
Thank you,
happy to
Christina.
have you here today. So
Thanks,
just
Christina.
just to start out with, I'd like to let people know that you are a board certified geriatric pharmacist and a certified diabetes educator. You've worked in various practice settings, including community and teaching hospitals, community pharmacy, and long-term care. You're currently the editorial director with Pear Healthcare Solutions and regional clinical coordinator with the University of Waterloo School of Pharmacy. Welcome, Rose.
Thank
So
you,
just
Christina.
to start out, one of the statistics that I've often heard is that over the age of 65, on average, people are taking five or more, or have five or more prescription drugs. And that another statistic I've heard is that some 25% of ED admissions are related to are drug related situations. Why is that?
Well, I think you said one thing that's very important there is the sheer number of medications that many people are taking. And I think, in many cases, that is warranted. I mean, there are a number of medical conditions people might have. There might be conditions that require multiple medications for appropriate treatment and to get people at a level where they need to be, or to protect them from worsening the disease or causing another condition. But the bottom line is we have a number of people who are potentially increasingly more frail who require more medications. And I think one of the issues when it comes to these problems that we see in emergency departments or people having what we call medication misadventures is a lot of that stems from people not understanding what their medications are for and why they need them, and therefore potentially not using them properly or duplicating medications. And that can be something that happens when people are, let's say a common situation is someone's hospitalized for some type of event, and then they come out of the hospital, they have new prescriptions, but it's not clear to them what to do with the previous prescriptions. So many times people will duplicate the same type of medication. Commonly happens, let's say, with cardiovascular heart type of medications or blood pressure medications. And there you go, into a problematic situation again. So I think it's really important that people understand what it is, why they're prescribed certain medications, what they do, what they can expect from those medications. So, and there's a lot of fixes to that. There's a lot of people that can help with that. But I think that's really something that, as the healthcare team and the pharmacist as part of the healthcare team with the caregiver and the older adult, working together to sort of rectify some of those issues.
So, what are some of the more common indications that somebody might be having um, a negative situation with their medication?
Do you mean like a side effect from a medication
Side
or?
effects,
Yeah.
yeah.
Yeah. So, one of the things I remember from my career as a pharmacist working in environments where I'm taking care of older adults is from a geriatrician many years ago who said, any symptom in an older adult should be considered a drug side effect until proven otherwise. And that always stuck with me, because as a pharmacist, that's what I'm looking at a lot of the time, is obviously the medications. And so looking at taking that approach of let's take a look at people's medications. So if someone is having a new symptom, let's say, that they don't know what it's due to or it's unusual to them, well, let's take a look at what medications they're taking. Is there anything that's new, anything that's changed? Or perhaps their health situation has changed and
Mhm.
it's caused them to react differently to a medication. So, um, that medications are such an important part of looking at how people feel day to day, and something that we need to reevaluate on a regular basis as well.
Yeah. So something like a fall
Mhm.
could actually be attributed to a medication issue.
Absolutely. And falls are one of the biggest causes. Fall medications are one of the biggest causes of falls in older adults, because of what we talked about earlier, the fact that people just tend to be on more medications, but it's also the type of medications that people are taking. And I actually read something recently that the number of medications that can contribute to falls, actually the percentage of medications people are using that can contribute to falls, is increasing in this population. And a lot of them are medications that are central nervous system acting, like antidepressant medications, seizure medications that are sometimes used for pain, those types of things. But there's a lot of other medications that can contribute to falls as well. So definitely that is something that, um, everybody should be aware of, that medications can contribute to falls. And it's not in always the ways that we might think. If I say to you, "Oh, how do medications contribute to falls?" You'd probably say, "Well, they'll probably make you drowsy," right? So, and that's the first thing that people will think about. So, medication that you use for sleep, perhaps, that can make you drowsy, or something like an antidepressant. Yeah, absolutely. If you're feeling drowsy or groggy, you might be at risk of falling. But we mustn't forget things like blood pressure medications that can
Mhm.
reduce somebody's blood pressure. And when you go from sitting to standing, your blood pressure can drop considerably. And that, in somebody who is more frail, that can contribute to a fall as well. Medications that can cause blurred vision, maybe those are eye drop type of medications, or other medications that can affect vision. Medications that can affect blood sugar, that can also make people lightheaded if the blood sugar goes too low. So there's a lot of medications that can contribute. So if somebody has had a fall, they're at risk of another one. So it's really important for that discussion with the pharmacist to happen, to look at the medications and see, okay, are there any contributing factors here? Maybe they need to stay on those medications, or maybe we can reduce the dose, or maybe we can take some off. So really, really important when you're talking about falls, absolutely.
And how important is it really to make sure that you take medications as prescribed? So, when it's take with food, or don't take any other medications until an hour after, and we're in a rush, or we forget, or we've missed a dose. How important is it that we really try and follow the medication regime as prescribed?
Well, I would say that that is really important. It's not to say that if you do something wrong once or twice that it's going to be really hugely detrimental, but what we're trying to do is optimize your benefit from the medication, and minimize any negative effects from the medication. So some of those instructions might, for example, the food piece, that might be related to actually making the drug more effective for you, if it's affected by food, or it might be the reason for it might be to make it more comfortable for you to take the medication. Timing of medication, oftentimes it depends on the medication. Some things should be spaced, 12 hours. Not very many medications, but some might work better that way. Um, Oftentimes though, if schedules, the way they're given to a person, are inconvenient for them, it's important to talk to the pharmacist about that, because what we can do is sort of look at it and say, yes, is there some flexibility in that schedule? And can we actually adapt it a little bit to make it easier for you to remember, easier for you to fit into your lifestyle, and
Yeah.
therefore, you're going to take the medication versus not
Yeah.
taking it and then having some negative effects. So,
Yeah. Yeah. So, Rose, what about vitamins?
mm,
We hear about how great B12 is, or your vitamin D, and of course, vitamin C, particularly in cold and flu season. What do we need to be aware of, though, with taking vitamins and prescription medication?
mhm. I think the biggest message here is, if you're going to purchase anything over the counter, be it a vitamin, a supplement, or another, what we call over the counter medication that doesn't require a prescription, um, it's best if you buy that at the pharmacy where you have your prescription, so that the pharmacist there will be able to check all your medications and make sure there's no conflict with your medications. If you can't do that, perhaps you have a list of your medications, and you can ask the pharmacist at that particular pharmacy to just take a look. There are some instances where you would think, a vitamin isn't going to be harmful. Some vitamins have iron in them. Iron can interact with some medications. Things like vitamin D, I mean, it's recommended actually that most older adults do take a supplement of vitamin D. So it's a good idea to ask your pharmacist a question, which is the right vitamin D supplement for me, because some of them are a little different. They're in combination with other things that might interact with your medications. So
Oh,
versus straight vitamin D, which is usually okay to take with most things. But again, I hate to make a blanket statement and not sort of direct people to ask the pharmacist again before taking something. The other side of this to think about is, do I need this, or is this going to be beneficial to me? And sometimes for many of those products, it's not like solid in terms of, yeah, you really should take this. And sometimes it's more, there's more evidence to say, you should take this. And that's why I go back to the vitamin D, because there is a lot of evidence there for taking that in a supplement form. But others, some people want to try them because they think it might be beneficial to them, but we simply don't have a lot of evidence to say for a lot of the vitamins and natural health products that, they will help a particular symptom or condition. But you sort of weigh that out with, you sometimes weigh that out with, what is the potential harm? And if somebody wants to try it and feel good about trying it and taking it, if there's no harm for them to take it, because it doesn't interact with any of their medications or conflict with any conditions that they have, then that's okay too. But that's a decision that individuals can make. But I do suggest, again, and I probably said this 3 times already, but always ask that question before you take anything else. Sorry, just to go on a little tangent on that piece, a very common thing that I've seen happening is people taking an over-the-counter medication that has a drug in it that's the same as a drug that they're prescribed. Acetaminophen is one. Sometimes you get prescription acetaminophen, another name for acetaminophen is Tylenol. And sometimes you have that in certain prescription medications, and somebody will buy a pain reliever over the counter that has the thing. And so someone might end up taking too much, which can be detrimental as
right.
well.
Yeah.
So those are things that people may not look at on their own, right? Unless they're very good at reading labels and reading everything and being really diligent about that. But many people don't. And so again, very important just to have that as a guiding principle. Always check if this is okay to take with my other medications.
So that leads me to a question about medication reviews. What are they, and how often should we be asking for them?
Mm-hmm. Yeah, well, this is a wonderful thing that we have actually in Ontario. We have the government funds the Meds Check program for pharmacists to provide what is called a medication review to people who are eligible. And there's no charge to the individual for that if they're eligible. And so what that entails, it might look different with different pharmacists, but in general, what the goal is to be able to review everything that the person is taking, including over-the-counter products, things that they've purchased without a prescription that may not be on the pharmacy profile, including all of those things, making sure that, they understand the medication, they know what it's for, they're taking it properly. And then from the pharmacist perspective, we would also sort of consider, do they still need that medication? And are they getting benefit from that medication? So we might have that conversation as well with the individual. And this is a really important thing to do, especially if you're someone who is taking multiple medications and if your health status has changed, or if someone has been released from hospital recently and they may have a different medication list. And that's that problem that I talked about earlier in our conversation, where I'm not sure if we should still be taking this, or is this the same as this, and is this just replacing this? So that whole piece needs to be clarified. So that's actually a really important time to do that with the pharmacist as well. And it's, it's hopefully most people have somewhat of a relationship with their community pharmacist if they're getting a lot of prescriptions already. So it's as simple as just asking, can I have a medication review with you? When can we do that? And how do you do that here? They may take appointments. They may do it on the spot. Every pharmacy is different how they handle that. But it is a very important thing to ask for. And I would suggest, people are eligible through the program once a year to have a medication review. And there are some follow-up opportunities available as well that are funded by the government, but pharmacists can always follow up by phone anyway. But definitely I would suggest, once a year, like if you are a caregiver looking after someone who's taking 10 medications, once a year, have that conversation. They're probably seeing their doctor on a regular basis, but they probably see their pharmacist more often.
Yeah.
So ask them about, when can we have this conversation? We'd like to have this conversation. And, I've done many medication reviews with the caregiver and the older adult together. And that's the best case scenario, to have the conversation that way. Because
it's very easy to forget if you're by yourself. And yeah.
Exactly. If you're getting instructions from the pharmacist, they're telling you things. I say, definitely having somebody else there, maybe to take notes or, ask more questions. And so that's the best case for people who do have someone, a spouse or a caregiver, an adult child, or someone who helps with their medications, to attend that with them.
Now, in more recent time, over the last few years, pharmacists have been given the ability to actually treat more conditions. I think it's up to 17 or something like that. So how would that work? Would I just walk into my pharmacy and say, I have I don't know, a boil on my toe or something?
Yes. Yeah, in a nutshell, sort of like that. There are very specific conditions and specific parameters that pharmacists are allowed to assess and decide whether it's appropriate for them to prescribe a medication for them, or if they should refer them to their doctor or nurse practitioner, whoever's their primary care provider. And as you said, there is a specific list, and yeah, I don't know exact number now because that's changing. There's some new ones that are coming in now.
Them, yeah,
adding them. But if you're, it's a good idea to take a look at the Ontario College of Pharmacists. You can actually see on their website what the list of conditions is. But it's actually good practice to just go in if you're experiencing something that you're not sure what it is, and ask your pharmacist, is this something you can help me with? And the pharmacist will be able to tell you if it's something we're allowed to assess and prescribe for. Because most of them are pretty, I would say one of the most common things that pharmacists are doing now is urinary tract infections. That's a common one. But they will also have very specific guidance in terms of what type of patient, what type of person they should refer back. So sometimes people who have more complex sort of clinical picture, like they have a lot of medications, a lot of certain chronic diseases, they might want to refer them to their doctor, just simply because it might be a more complex problem. But definitely it is worth asking. And if it is within the pharmacist's scope, if it is in our scope of practice, and the pharmacists themselves is comfortable actually doing that assessment and prescribing, they can take care of that, and they would actually write the prescription, and you can fill that prescription wherever you want. You don't have to fill it with the pharmacist who did the assessment, but you probably would because you're there anyway. But you definitely don't have to. And then the pharmacist would share that information with the primary care provider, so their family doctor or nurse practitioner, so that they're all in the loop of that assessment that happened.
So what would you recommend to people? Somebody is on vacation and they left their medications at home and they don't realize it until the plane is landed at their destination. What would you recommend in that situation to do?
That's a tricky one. I think it depends where they're going on vacation. If they're in the province or in the country, it's a little bit easier. They could probably have the physician fax a prescription, or a pharmacist transfer a prescription, again, depending on the jurisdictions that they're in, and then have it filled in their location where they are. If they're out of the country, that might be a bit trickier. I would say that, again, depending on the country, they may have to see a doctor there. I mean, they can certainly show them a list of their medications, and they might have to see a doctor there, which would complicate things a little bit more. But within the country, there's a little bit more of that transferability of information and, sharing amongst health professionals. And certainly in the province, it's a simple one, but and even within the country, there's a bit more leeway there. So but yeah, try to avoid that. I guess that would be the message.
Yeah, I guess,
proper planning.
glasses, wallet, keys,
Yep.
passport,
Medications.
medications.
Yes, and in your carry-on bag if you're flying as well too, so that they don't get lost with your luggage if your luggage gets lost.
So what
Right.
are some of the key things that you emphasize when you're doing education with older adults about their health in general, but specifically about their medications and
Yeah, I mean, there's quite a few things. I guess is like I said to you at the beginning, really understanding what the medications are for, and a lot of times when I've had conversations with people, I find that when I ask them, they often don't know what they're for. So I think that to me is one of the big pieces, because if they don't know, they won't know what questions to ask when it comes time for a question. So there's a really nice resource that we can include, actually attached with this podcast, if possible, on 5 questions that people should ask their healthcare provider about their medications. And it's things that I would encourage people all the time. And these are things like, are there any changes to my medication? So is there a dose change? Is a timing change? Should I continue this medication? So if a new medication is prescribed, let's say, should I continue that old one? Are you adding on to it, or are you replacing it? Because, sometimes you might say, oh, I'm going to prescribe this. Okay, well, what does that mean? So you need to ask that question to make sure you're crystal clear. Proper use. How do I use this medication properly? And yeah, if it's a pill, it's a tablet, a capsule, you swallow it with water. Can I crush it? Can I break it? Can I open the capsule? If it is an inhaler, how do I use that properly? If it is a self-injection, some people are injecting subcutaneous medications like insulin and other medications. Monitoring. What should I be looking for to know that this medication is working for me, or it's not working for me? And then when should I follow up? When will we follow up? When should I meet with you again? When should I talk to the pharmacist? Or if you're talking to the pharmacist, when will you contact me to follow up? So those are some really important questions that people should be prepared to ask. But I think you're best prepared to ask those questions if you know about your medications a little bit, right? You know what you're on, what it means, why you're on it, what conditions you have that you're, if someone were to ask you, okay, so what do you have diabetes? What are you taking for diabetes? You should be able to list those medications, or at least have a chart and say, these are my diabetes medications, right? So Yeah, I think that's a great, in a nutshell, I think, educating people about that in terms of what they should know about their medications from a safety point of view and from an effectiveness point of view as well.
So earlier on, we did talk about side effects and sort of recognizing what might be a side effect from a medication as opposed to, you know, something else with a fall. But as a caregiver, what are some of the signs that I should look for in my loved one that might indicate to me that they're either non-compliant with their medication or that they are having an adverse reaction?
So I guess there's a number of things you can look at, and of course it will depend on the medication, but if their symptoms change, if their symptoms change in a negative way, for example, maybe as a caregiver, you're taking their blood pressure on a regular basis and you find out that their blood pressure is getting higher and higher. Are they taking the medication? If you're not actually giving them the medication and you don't have like a pill box that you can actually check that they've taken the medication, are they taking the medication? So if the symptoms change, um, from a pharmacist, well, I guess you're running from the caregiver point of view, but even from the caregiver point of view, if they're not needing to refill their medication as often, so that might mean they're not taking the medication. So
Mm,
that could be problematic as well.
good point. Yeah.
Um, yeah, yeah. And, other things that can, when you're asking about side effects, I'm thinking about sort of common side effects, drowsiness, dizziness types of things. So if people are a little bit more off, or they say that they're lightheaded, or you see that maybe their balance is off, those types of things might indicate potentially a side effect of a medication. And really, like I said earlier to you, think of the medications first, right? If you see something unusual or different happening with the person that you're caring for, take a look at the medications. Ask the pharmacist, hey, anything here change recently, or anything that you think, might be, or maybe if they're not taking it, that would contribute to this symptom. Yeah, just a little pause here while I think of another example for
Okay.
you, Christina. Yeah, so the drowsiness, the confusion, I mean, that's another thing too. I mean, there's a lot of medications that older adults might take that affect the central nervous system, which can cause confusion as a symptom that someone might see. So,
Oh.
or, memory impairment, somebody forgetting things, somebody, seeming a little bit off, like they're not with it. That could be a medication side effect of certain medications. Yeah, so there's quite a few things, and I guess it's hard to pick specific ones because it's really dependent on the medication. Here, I'll give you another one that just came to mind. Actually, if somebody's on blood thinning medication,
Mhm.
sometimes you might notice bruising. So that could be something that just happens in somebody who's very frail and small, and you would notice it more. But if it's happening more often, or bigger bruising, something like that, then that could indicate they may need to change some of that medication. And something, as I speak out loud about this, I'm thinking about medications for that are blood thinners that depend on kidney function to be metabolized properly. And so sometimes, as we get older, not sometimes, but all the time, as we get older, our kidney function declines,
Mhm.
and it can decline with certain medical conditions like diabetes. And when that declines and we're not changing the dose of certain medications, those medications can have a greater effect in some cases. So that's another thing that, again, people wouldn't think about. And it's not really so much the responsibility of the caregiver to be thinking about that, but that's something as a pharmacist we think about is, has the person's kidney function changed? And there's certain blood tests we can look at there, because that might affect the dosing of medications that's required. So um, if you see changes like that, again, there's reason to look at the medications. Are the doses still appropriate for that person? And
Mhm.
the other piece is the medication helping them? I don't know if you've heard of the concept called deep prescribing,
No.
Christina. No, that's something
Deep
that
deep?
D, no, D,
Oh,
like
D.
DE, yeah,
Okay.
like off prescribing, de-prescribing. De-prescribing means like intentionally stopping or reducing medications that are no longer beneficial or can be potentially harmful for a person. And there's been a lot of research done in that space in the past, I don't know, maybe 10 to 15 years. And in my days in long-term care, we used to look at that quite a bit, even before de-prescribing really became a thing that was more broadly known. Because sometimes as a person gets older, certain medications may not be helpful for them or may not be beneficial for them and
Mhm.
not needed anymore. So that's another reason for that medication review too. And there are a lot of great protocols now to help pharmacists and physicians look at how to taper and stop certain medications that are no longer beneficial for a person. So that's an interesting thing because sometimes, I think one of the questions people ask all the time is, do I need to take this forever? Am I going to be on this forever?
Yeah.
And in some cases, yeah, I mean, some cases you do have to, but not everything. So I think that's another good question to ask is, do I need to continue all of these medications? And so
Mhm.
oftentimes the answer will be yes, but sometimes it won't be. And so that's just a little pearl and a little nugget for people to know that that is something. And some of the things that come to mind when I think about deprescribing is drugs that are used for sleep, sleeping medications.
Uh-huh.
Benzodiazepines is the term for things like Ativan, lorazepam, those type of drugs. Ativan's the brand name of lorazepam, and those are medications people often take for sleep. And those medications can be harmful to people, but I know that many older people take them for sleep at night. And some will say, you know what, I can't live without it. I need it to sleep, which is fine. But some will say, you know what, I'm still having trouble sleeping. And, maybe they're even having trouble the next day because they're still groggy or they get dizzy or, they're still having after effects of that medication. That's a situation where we would say, okay, so let's see if you really need to keep taking this medication
Mhm.
and address that. So that's a common one I think that we would look at as, is that still needed for that person? Is it safe for them? And is it giving them a benefit? So
Yeah.
there's a lot to unpack in that space, which I don't know if we have time for today, but maybe in another conversation. But
Well, I think, the point that you're making really is that medications can have a very positive benefit, and that's why they're prescribed in the first place, but they are chemicals, and so there's also some caution that we have to take in making sure that we're taking them appropriately in the right amounts and the right times, and that sometimes, they do interact with other things, even something as we might think as consumers are very benign, like vitamins, like vitamins are good for you, but potentially not if they're taken with something else that's going to counter the effect or give some negative side effects. So very important to learn.
for
We're
sure.
actually at our time, and I have found this so interesting, and I really love the 5 questions that you can ask. So, for sure, we'll be, passing that along. But I do wanna thank you for taking the time today, Rose, to be on our program. Let's chat about aging in your community and, just sharing this wealth of information. And I think just from the standpoint of being an older adult, but also a caregiver, it's been very informative. And I thank you for being with us today.
My pleasure. Thanks for having me, Christina. It's great to be able to share this information with you and all of the listeners.
Great. Thank you. And thanks to all of you for tuning in once again to Let's Chat About Aging in Your Community with chats, community and home assistance to seniors. We hope that this program and podcast brings you the kind of information that helps you become better informed and able to live out your vision and dream of aging in your own community and being able to stay healthy and well. All the best and we hope to see you next time.